with Dr. Freda Lewis-Hall, Pfizer's Chief Medical Officer, to answer your questions in our Ask the Doctors segment. I really enjoyed these segments, so let's just jump right in. You're Alexa, right?
I am.
Okay, so Alexa, you have a question. How can we help?
Hi, doctors. I have a question for you guys. So I thought I was managing my blood pressure, but my doctor recently told me that the guidelines have changed and now I'm at risk. What do you think I should do?
Well, that's a really good question because I had read the same thing, that they've changed the guidelines and dropped like one of the categories. So tell us about it.
Yep. So in 2017, the American Heart Association and the American College of Cardiology released new guidelines for the diagnosis and management of high blood pressure. And it's really the first update since 2003. Basically, the new guidelines say that the diagnosis of hypertension or high blood pressure is made when your blood pressure with a blood pressure cuff reads 130/80 or higher. Now remember, the top number is your blood pressure when your heart is beating. The bottom number is your blood pressure when your heart's at rest between beats. Now, it used to be 140/90 or higher. And with that change, essentially, we've done away with the category of pre-hypertension. And basically, these new guidelines are designed to help people get really motivated and energized and in treatment for this potentially deadly illness earlier with their healthcare team.
You talk about getting involved earlier. Exercise is really important for this. You're going to talk about that in a second, but you've got to make an appointment with yourself. And the thing that I hear from people most of all is they plan to do it, they mean to do it, the day gets busy and it gets crowded out, and it's easier to cancel an appointment with themselves than with somebody else. And you just can't do that. You got to make an appointment. If you're going to go to the gym or you're going to walk around, you're going to do whatever exercise you're going to do, you got to make an appointment with yourself and keep it.
Yes.
And because you can't be a Johnny-come-lately with this. You need to get started on this now and be consistent about it. And knowing the guidelines have changed and Alexa may be at risk, what should she do now? What if she makes these appointments with herself, what should she do at those appointments?
So the first appointment that she should make is with herself and with her healthcare team.
Right.
And your healthcare team may actually tell you to do a couple of things right out of the gate. So first of all, you may want to monitor your blood pressure at home in addition to your routine health checks with your healthcare team. That's for starters. And then the other thing is that they may help you design a treatment plan that helps you get out in front of or helps you keep your blood pressure in check, if you would. And that can include lifestyle changes, or they may prescribe a medication for you. So here's some things that you can do to keep your blood pressure in check for starters. So the first thing is managing weight. So manage your weight. Manage your healthy diet. So it isn't just weight, it's a healthy diet. And make sure to reduce that sodium. That is so very important. Mm-hmm. And get active. The right amount of exercise will help you with your circulation, your strength, and your balance. And if you drink, limit alcohol. Drink no more than 1 to 2 drinks per day. So all of these things are so very important in managing your blood pressure.
Yeah. Well, to learn more about your blood pressure and how to manage it, you should go to the website, gethealthystayhealthy.com.
And of course, while you're there, you can sign up for the monthly newsletter and helpful information will come to you.
Well, Dr. Freda, I believe these Ask the Doctor segments are so important and helpful, so let's do one again soon, okay?
Okay. We'll look forward to it.
Appreciate it.
Thank you.
All right.